So a movement disorder neurologist is someone who treats people with conditions that are related to motor control. So there isn't actually any weakness or numbness, but it's a difficulty in controlling movements. And there are different types of movement disorders. There are movement disorders where there's too much movement, where people, for example, have a lot of tremor or shaking, or may have pulling and posturing. And then in other movement disorders, there's too little movement, and people move too slowly, have difficulty getting up from a chair, getting up from a seat, things like that. And Parkinson's is one of those movement disorders where people can have too much movement in the sense of sometimes they have a tremor at rest, or, but generally there's an overall slowness of movement. So the conditions that we treat with too much movement are something called dystonia, with the sustained pulling, twisting, and posturing movements, and it depends which parts of the body are affected, depending upon what time in your life that you're affected with dystonia. And then we also treat essential tremor, which is a tremor that may affect the arms, the voice, and the head. And with that, there's usually a tremor with action rather than at rest. Parkinson's is, most of our patients have Parkinson's, although we specialize in conditions also that have a strong genetic component, and we do a lot of research at Beth Israel into understanding causes and what's going on with Parkinson's. And we partner with a lot of other groups as far as doing genetics and what we call epidemiology related research. And for Parkinson's, so there are different symptoms of Parkinson's. Classically, people think about the tremor at rest, but as much as a quarter of people with Parkinson's never have any rest tremor. The flip side is that everything that shakes or has a tremor is not necessarily Parkinson's. And with Parkinson's, at this point we don't yet have a cure, but there are sort of three main areas we think about treatment. So with Parkinson's, there's a loss of cells at the base of the brain called the substantia nigra, and these are cells that make dopamine. And when we think about treating Parkinson's, we think about three main areas. We think about what is neurorestorative, so that's what replaces and can help those replace the dopamine neurons. We think about what's neuroprotective, so that those neurons that are there, so you can maintain them and stay where you are. If we had great neuroprotective therapies at this point, that would be terrific. And then we think about symptomatic treatments to help the symptoms. And not everybody needs symptomatic therapies, but they're certainly there and available to people as far as helping the slowness of movement, helping the tremor, and helping especially dexterity in hand movements and writing. And just to step back for a minute, so as far as the neuroprotective therapies, there are no proven therapies. There is a lot of data now with exercise, so we do think that it is very important to get going with an exercise routine for people who have Parkinson's. And as I said before, we don't have any neurorestorative therapies, but we do have a lot of symptomatic therapies. And there's a lot of research going on with Parkinson's. There are many different directions that the research is going. One of the things we're involved is genetics research, and it may be that there are specific therapies depending upon the cause of Parkinson's. And then there are also therapies in multiple different directions, and ultimately it will probably be the cure will arise not from a single therapy but a combination of therapies. Now, with regard to research for Parkinson's, so there are several levels of research. There's what we call observational studies, and with those, this is clinical research where we're trying to understand the causes for Parkinson's. A lot of what we do here is focused on genetic causes of Parkinson's, with the understanding that most people don't have a family history of Parkinson's, but there's still things in our genes that may make it more likely for us to develop Parkinson's. And trying to understand what these causes are, and then particularly we talk about Parkinson's disease as if it's one disease, and there's actually a range as far as Parkinson's, and people may have one type of Parkinson's more than another, and in understanding these different types of Parkinson's, this actually helps us tremendously as far as guiding clinical trials and working with the pharmaceutical companies as far as designing trials so that they are as efficacious as possible. We are also involved in clinical trials at Beth Israel, and our trials are both in Parkinson's as well as in other movement disorders. And the trials are often such that there are trials for people who've been recently diagnosed, as well as people who have had Parkinson's for a medium period of time, 5 to 10 years, and then people who've had Parkinson's for a much longer period of time. And the trials are ranging from medications. Sometimes there are trials for surgery and surgical options as well. People can lead very full, active lives with Parkinson's. Sometimes people ask whether one should keep working if you have Parkinson's, and we often do encourage people to keep working. Many younger people with Parkinson's are able to continue working, and people who've already retired who have Parkinson's can also lead very full lives, exercising, doing other things, enjoying their families. So with the symptomatic medicines, which we use to treat symptoms and to improve specific things in everyday life, we can help people to live their lives to the fullest and to keep going with their Parkinson's for quite some time. And the treatment schema is such that we try and we work with the patients, and it is a long-term relationship until we find a cure for Parkinson's.